Hello and welcome to the Team Omega United Airlines PowerPoint. Throughout this term, Team Omega split up the tasks and delegated work based upon our individual roles within the group. Heidi Slocum was the main leader, shaper, and organizer. She came up with team deadlines and delegated research within the group, as well as kept the group up to date and aware of deadlines. She also aided greatly in group communication by letting everyone know when an idea arose in a private conversation between members. Johnny Peacock acted as the coordinator and a secondary organizer. She helped team members stay focused on the tasks at hand and ensured that deadlines were met. She also helped Heidi with task delegation by dividing up individual sections during the research portion of the project. Jessie Scales was the group's researcher. She found specific sources and data to back up the theoretical ideas presented by the group. She also edited and narrated the script for both the rough and final draft of the presentation. Tara Jones was a secondary researcher. She focused on researching past events involving disease outbreaks to give insight into how to improve actions in future scenarios. Tara also wrote the scripts for the rough and final draft of the presentation. Today we will discuss possible scenarios to help United Airlines mitigate future health epidemic dilemmas. Because our findings were based primarily on the recent Ebola health crisis, we will begin by giving background and history on the event, including its major effects on United Airlines. We will then define the needs and goals that United must meet to successfully handle a future outbreak, and suggest several different ways in which United might meet those goals. Each option or scenario will be analyzed for its potential risks, and a new finalized scenario will be produced which optimizes success while reducing risk. Finally, we will discuss the projected outcomes of the scenario plan, followed by an assessment of useful scenario planning theories and a list of our sources. To better understand how United might handle future health crises, we must first understand how it handled crises in the past. As the Ebola crisis was the most recent example of a disease outbreak, we chose to use it as our primary source of background material. On September 19, 2014, Thomas Duncan arrived at the Thomas Dulles International Airport in Dallas, Texas. After boarding an airline in Liberia, Duncan transferred to a United Airlines flight from Brussels to the United States. Although Duncan showed few symptoms in flight, upon landing he became feverish and ill. Later it was determined that Duncan was infected with the extremely contagious disease Ebola. It became clear that Duncan had lied to the disease control officers who had performed the mandatory questionnaire about whether he may have come in contact with Ebola while staying in Liberia. Duncan's lie was fatal. Not only did he die of Ebola, his passing contact with a pregnant woman outside the airport also caused her death. These deaths caused widespread panic, and the CDC was forced to install strict regulations on air travel and passengers flying from any Ebola-infected locations. The number of flights departing from these locations has been drastically reduced to lessen the risk of spreading the disease. United does not appear to be experiencing major losses in flight sales. However, it will likely follow in the footsteps of Delta Airlines and reduce flights to and from infected areas. Losses from these cut flights have not been determined, although NASDAQ shows that airline stock prices fell 20% in the month following the Ebola scare. The recent drastic alterations of the airline industry show that United and other airline companies were unprepared for disease outbreak. Public panic has been devastating for stock prices and will likely cause an overall decline in ticket sales. To reduce public panic and financial losses in future health crises, certain issues must be resolved. United must address the concerns of both passengers and crew members in regards to health safety. United's goal must be to provide the most comprehensive on-board early detection and containment program for contagious disease. United then must change its advertising tactics from defensive to offensive. All media coverage and consumer information must be adapted to assure customers of their safety aboard United flights, as well as provide them with additional resources on prevention and disease recognition. To avoid losses and prepare United for future health epidemics, Team Omega has developed several options to reduce public fear, as well as increase public and employee safety aboard at-risk flights. These options have been developed based on past experiences, requests of the Association of Flight Attendants, AFA, and the need to provide the highest level of safety and security for all passengers. The first option involves adding additional disease symptom recognition training for all flight attendants and in-flight crew members. This training, moderated by CDC infectious disease officials, will keep crew members aware of possible disease threats as they arise, as well as give them instruction on how to quarantine or give minor treatment to potentially infected passengers. Common symptoms associated with major infectious illness include fever, sore throat, headache, nausea, fatigue, back, neck, or appendage pain or stiffness, muscle weakness and tenderness, and shortness of breath. A symptom list for all the major contagious diseases, including Ebola, MERS, and the avian flu, can be found on the CDC website linked at the end of this presentation. In addition to training sessions, this information will be available to all crew members on board planes traveling to and from at-risk areas. Upon suspicion of infectious disease, crew members will immediately report all findings to the CDC and, if necessary, plan for an emergency landing at one of the 20 international airports stateside with U.S. quarantine station. There, passengers will be handed over to CDC officials to receive protocol screening. The second portion of our plan is to comply with the requests of the Association of Flight Attendants. Of the requested items, United Airlines will supply on each flight non-allergic medical gloves and masks, one universal kit for each flight attendant on duty, and 2 additional universal kits for intervening medical personnel. An adequate supply of surgical masks and leak-resistant air-sac bags will be supplied, as well as necessary equipment to take the temperatures of potentially infected persons. All of the preceding items will be no-go items and will be required for the aircraft to dispatch. Additional supply costs will be added to the overhead costs of flights. To protect the health and safety of onboard crew, United will provide pay and benefits for all flight attendants removed due to risk for Ebola or other communicable disease contracted on UA flights. The last portion of our plan is to set up a reliable warning and prevention system for our passengers by providing customers and potential customers with up-to-date information on disease outbreaks, as well as ways passengers can protect themselves while aboard at-risk flights. Both the United Airlines website and the in-flight website will add a link to the Travel Health Notices page on the CDC website. On this page, potential customers can view current health issues in order of urgency, as well as view CDC-approved travel guidelines. United will also provide brochures aboard all flights documenting preventative materials aboard, such as masks and gloves, along with their proper usage. Passengers can then use these items at their own discretion. The primary risk for additional training for crew members is cost. The airline will have to pay appropriate parties to thoroughly train crew members. Additionally, crew members may demand a wage increase to account for the additional skills and knowledge required to handle disease aboard planes. Trained employees are not medical doctors and thereby are likely to make identification mistakes. There would be high costs associated with false disease identification, as each identification would require a full response until confirmed non-threatening. These false identification could cause consumer alarm and lower the number of ticket sales. Putting 100% of additional costs into ticket prices could potentially raise consumer costs so drastically that consumers would look to other companies for less expensive flights. Therefore, it is likely that the company would have to take on, at minimum, a partial burden of cost while simultaneously losing a customer base of the guaranteed small number of passengers who would choose to avoid travel in disease-ridden areas regardless of United's additional precautions. Option 2 also comes with a serious financial burden. The airline will have to spend a considerable amount on medical supplies made at a high enough quality to withstand serious disease. These items will need to be replaced on a regular basis to account for natural degradation of materials or in case of disease exposure. The airline will also carry the financial burden of paying for exposed employees. Once again, raising ticket costs could push consumers to find less expensive airlines and decrease the number of ticket sales. The final option provides the fewest risks for United. There is a slight financial burden to pay for the informational material, but this could potentially be added to the in-flight safety information already provided. Adding the CDC link to the website has very low risk, though it could potentially make consumers more alarmist and less likely to fly. It could also make passengers more likely to falsely identify disease and/or more likely to use the expensive onboard medical materials. Our finalized scenario plan implements the strongest portion of each of the proposed solutions while minimizing financial burden and other risks. Symptom recognition training will be provided first to high-risk employees, those in direct contact with passengers in high-risk areas. Over a several-year period, all employees and new hires with passenger contact will receive mandatory CDC training. No planned salary raises will be given, and all employee absences due to disease will adhere to standard employee care policies. By spreading out the training period and limiting the trainees to relevant employees, United can limit initial investment costs and prevent a spike in ticket prices or significant quarterly financial losses. All suggested materials from the second section will be provided aboard planes, beginning with flights in high-risk areas, then slowly adding these materials to all United Airline flights. Additional costs will be included in ticket prices, primarily focusing on increased fares for business class. Economy fares will be the least affected, so as to transfer most associated costs to larger companies rather than to singular consumers. Furthermore, it is hypothesized that consumers will be willing to pay for the added sense of security by flying with an airline highly concerned with health safety. Because the changes in the third section have little risk, they will be implemented fully. In-flight brochures will be edited or additional brochures will be added to seatback pockets, informing passengers of new materials and precautionary measures. Links to the CDC will be added to the United webpage to give passengers easy access to travel health precautions. By implementing a combination of disease recognition, materials for prevention, and a health-conscious media campaign, United can carve a path as the forerunner of health safety in the air travel sector. Passengers and crew members will be provided with ample resources to promote disease awareness and prevention, and all in-flight personnel will be prepared with quarantine and emergency landing procedures if disease is detected on board. These additional precautions will help to build trust between United Airlines and consumers and help to keep sales steady during health outbreaks or public panic. Lewin's normative model of planned organizational change is a theory based on his belief that social institutions, including organizations, result from a balance of forces, some driving change and others restraining it. Lewin believes stability is not just maintained by the forces opposing change, it also represents a stalemate between forces for and against change. United Airlines is currently experiencing this stalemate. Although most companies are resistant to major change, by changing, United will better prepare itself for potential scenarios involving medical crisis and communicable disease aboard flights. Lewin's theory is based on bringing planned changes. His model shows that planned change involves three separate practical activities: unfreezing, movement, and refreezing. To handle future scenarios most effectively, United Airlines must unfreeze their current policies for handling disease outbreaks by examining them and acknowledging their shortcomings. They must then create movement by following the actions previously outlined in our scenario plan. Finally, United must refreeze the company, solidifying the new information and procedures, but still leave room for further change and adaptation. Lewin's theory feeds into Haradimo Tsuka's and Robert Chia's process theory. This theory argues that an organization is a continually evolving process and that organizations are in a perpetual state of becoming. Sukas and Chia felt that the modern perspective's focus on entities, structure, and end states is mistaken, and that instead organizations should be founded on the basis of change. If United Airlines adopts this method of constant adaptation, they will be able to take a proactive, preventative stance towards passenger health and safety rather than a reactive, defensive stance. United will therefore be more able and more willing to quickly adapt to unseen disease outbreaks, and will be more willing to adopt new policies and technologies to further prevent the spread of disease. As the success of the process theory model grows within the health and safety sector of the company, it can continue to expand, allowing other sectors, or potentially the entire organization, to become more adaptive and proactive overall. Carl Rogers' communication theory advises unconditional positive regard within relationships. He believes that by holding this attitude, people can experience deeper levels of trust. By using the three primary aspects of Rogers' theory, congruence or genuineness, unconditional positive regard, and empathetic understanding, United can find real understanding of the fear and concerns of their customers. This understanding will not only add urgency to implement plans to help protect customers, but will also help to build trust and loyalty between United and their customer base. This trust and loyalty will fortify the company against decreased sales during future health crises. Furthermore, a new, empathetic, and honest approach to marketing efforts will help United repair previous damage made by defensive marketing strategies. Past disease outbreaks have been problematic for airlines because both potential customers and employees fear for their health and safety. Flight sales drop, stock prices drop, and employees are unsettled and afraid to come to work. By training employees to recognize potentially dangerous symptoms and ensuring they know when and where to report them, United can help to mitigate the fears of both employers and passengers. They can further ensure passenger and employee safety by providing medical equipment such as masks and gloves aboard all at-risk flights, in addition to informational material about potential health risks and preventative measures. By taking active steps to protect passenger safety and prevent the spread of disease, United can develop trust with its customer base and prevent financial loss during health epidemics. In conclusion, with the aid of multiple resources, Team Omega has developed a comprehensive scenario plan to help United successfully navigate potential future disease outbreaks. By following this plan, United should be able to gain the trust of both employees and customers and avoid losses during times of health crisis.